So your paperwork says that you're here because you've been experiencing some confusion, some facial numbness. Can you tell me a bit about the confusion? Okay. Okay. And about how often does this happen? For how long? Like, how long are the episodes, do you think? Okay. Do you have an idea about when this started? Okay. Do you think the numbness might be connected to the confusion? Like, do you feel that sensation close to those episodes? Okay. Is the numbness constant? Okay. Is it everywhere on your face or in any particular location? It changes. Okay. And are you feeling any kind of numbness anywhere else? How have your stress levels been? Okay. And how have you been sleeping? Okay. Really quickly, may I have you just smile for me? Yep, big cheesy grin. I'm just gonna use my pen to check the symmetry here. Okay. Now if you can frown for me, like really furrow your eyebrows. Yeah. Can you hold your hands out in front of you like this, kind of like you're sleepwalking? Okay. Keep your hands out in front of you. I'm going to push your hands down and I want you to resist me. Okay? Now don't let me push your hands up. Okay? Now I want you to have your fingers splayed like that, and I'm going to try to push them together. Good. Okay. One more thing really quick, and then we'll move on to your face. So I'm just going to check your reflexes here really quickly. So are you experiencing that numbness right now? Okay. So I'd like you to close your eyes, and I'd like you to keep them closed for a bit, okay? I'm going to be doing some sensation testing with a few different instruments. So I'll be using soft, sharp, don't worry, not sharp enough to hurt you, blunt, and then we'll also be using some different puffs of air, trying to see if I can narrow down where that numbness is occurring and where it may be even originating from. Okay? Okay, so go ahead and close your eyes, and I'm going to start with soft. So and I forgot to mention, raise your hand when you feel something, okay? Okay. Good. Okay. All right. Keep your eyes closed. I'm going to be switching. All right. Switching again now to blunt. Good. Excuse me. Okay. Now here comes the first types of ear puffs, okay? Last set. Okay, you can open your eyes if you like. So it appears that you did feel all of the different areas where I tried to stimulate some kind of sensation. Were there any areas or any materials that felt, I guess, more diminished, or that you felt more strongly? Okay. That's okay. Sorry for my throat clearing. One of the downsides for heat waves for people with asthma and allergies, which I have both, is that the heightened temperatures can actually increase the pollen count, which is providing me with a bit of a scratchy throat. So hopefully it's not too distracting for you. Okay. I'm going to be palpating your cranium. Okay, so your head. I'm also going to look at your jaw, right? Feeling for any kind of bumps, any flat spots, anything that may be a little bit different from our baseline for normal. And even if I find anything, it doesn't necessarily mean that these are the culprits for causing your symptoms. But it is good information to have noted, okay? Okay. So, if there are any areas that cause you any kind of tenderness, any sensitivity or discomfort, please let me know, okay? Okay. Just feeling symmetry here. Have you open and close your mouth for me? Perfect, okay. And again. Good. So now I'm going to feel your neck, okay? Just looking to see if there's any inflammation, particularly in the occipital area. Have you had any headaches? Okay. Okay. That all feels okay. Now I'm going to palpate some areas on your face, okay? So again, let me know if anywhere causes discomfort. Really quickly, can I have you close your eyes? Okay. Really squeeze them shut and try to resist me forcing them open, okay? Good. Okay. You can open. Okay. Focus your gaze right here between my eyebrows, okay? Good. Don't turn your head at all. Just follow my light, just using your eyes. Good. sorry for the intense eye contact, but if there's any kind of skips or tremors or anything abnormal, sorry, I don't want to miss it. Sometimes these things can be very subtle. Okay. Stare right between my eyebrows again and let me know when you see my light enter your field of vision. Good. Can you tell me which of my fingers is closer to you? Okay. Good, okay. All right. Now, going to do a quick exam of your ears, okay? And then we're going to do a hearing test that's also going to include a little bit of some cognitive testing, okay? First, I want to just take a look at your ears. Just look at the back. what I'm going to do is I'm going to whisper a series of numbers into each of your ears, okay? I want you to repeat them back to me, but there's a caveat. I want you to recite them back, putting them in numerical order. So for example, if I were to say 19, 3, 27, I'd want you to tell me 3, 19, 27, okay? So ranging from lowest to highest. Does that make sense? Okay, good. So, I'm gonna begin. One last set each side. 32, 10, 15, 38, 36, 41. Good, okay. Actually, I'm going to take my gloves off because I don't need them anymore. Okay. So we're going to do one more neurological exam. It's kind of more of a test than an exam. And then we're going to do 2 cognitive tests following that. And then we will discuss a plan based on the rest of our findings. So, I'd like you to sniff this, okay? Don't worry, it's safe. Okay. What is the scent? Lemon, yes. And this one? Yeah, a little less pleasant. That one is vinegar, correct. And this one. Peppermint. Very good. Okay. Okay. So now for our first of 2 cognitive tests. So I'm going to open this paper bag here, okay? And I'm going to place some objects in it. I want you to do your best to pay attention to those objects. And then once I've placed them all in the bag, sorry, gravity was doing something weird there. Once I've placed all the objects in this bag, I want you to tell me all of which ones are in here, okay? So, don't worry, there's not going to be too many. Okay. So, I have a comb. I'm going to put my pen. Put this Q-tip. And roll of tape. And a cotton ball. Okay. So, can you tell me what's in here? Yep. Good. Good. Nice. Oh, no, you don't. Okay. Yep, good job. Okay. Okay. So excuse my not exactly perfect circle. Okay. So can you tell me where on this clock 3 should go? Yep. Okay. How about 11? Good. And 5? Good. How about 9? Yes. And the 1? Good. Okay. Okay. So I was not able to reproduce your symptoms on exam, which is okay. However, it also doesn't really help us find a diagnosis today. What I would like to do is order an MRI with an angiogram, so looking at your brain and also the vasculature of your neck as well as your nerves. Just making sure that there's not any kind of issue there that could be contributing to your symptoms, particularly the numbness in that case. And then I'm also going to order an EEG, electroencephalogram, which is basically going to map your brain activity. Sometimes confusion like this can indicate the presence of some seizure activity, particularly focal seizures if you're not aware of what's going on. Focal seizures, sometimes people don't even know that they're having them. It can feel like lost time. People can even talk and interact a lot of the times during them. And to an outsider, it'll look kind of like you're staring off into space. Your eyes might move a bit. You might have some twitching, but it can look pretty normal to an untrained eye. That being said, it also makes it difficult to really diagnose unless I'm able to see it happen or get a reading of what's going on in your brain. So based on what those findings show us, then we can come up with next steps, whether that's further imaging or further testing. And in the meanwhile, do you live with anyone? Okay. So anyone you live with or any people close to you, family, friends, I would ask them if they start seeing you do anything kind of funky to take out a camera and record it, and then send that to you so that when you come back here in a follow-up, I can review that video and see if there's anything happening that I can recognize. Okay? Okay. Do you have any questions about that so far? The EEG is not invasive. So basically, one of our techs will basically kind of give you a scalp exam and place electrodes in specific areas on your scalp. There are quite a few. And then it's kind of like you'll get to take a nap for a while. There will be a couple things they'll have you do, like sort of purposefully hyperventilate. There will also be a point where they'll have a flashing light in front of you. Your eyes will be closed though, to see if they can't induce any kind of seizure activity, if in fact that is what's occurring. And it also can tell us if you have any kind of brainwave variance, because not everybody's brains work the same, which can mean also that we need to look at things a bit differently. But it's nothing, there's no needles, there's nothing going into your skin, it's just a bunch of stickers on your head. Okay, yeah, nothing to worry about. So, and the angiogram and MRI I am going to have with and without contrast, so that way I can have a really clear full picture of what's going on, and I can see all of your nerves, all of your vasculature light up, and see, you know, if there's any fluid in the brain, any kind of issues. Have you ever had contrast before? Okay. Well, the radiology techs can discuss with you any risks, but it's usually a pretty benign procedure. You might feel kind of like a flushing sensation. Sometimes people feel like they're going to pee their pants, but you're not going to, okay? It's just the medication. So, I'm not going to make you stick around to get any results. You can go home afterwards and I'll just talk to the radiologist and give you a call once I have that information. So then after we have all these scans back, I'd like you to come in for a follow-up. But first, let's get these scheduled so that way we know when scheduling a follow-up would be appropriate, because I want to make sure we have all of our information before you come back, okay? Okay. Do you have any questions about any of this? Okay. Well, if that changes, feel free to give me a call, okay? And either myself or one of my colleagues can address those questions for you. In the meantime, I'm going to go pass this off to our front desk so they can start getting these scheduled for you, okay? Okay. It was nice to see you, and we'll talk very soon.